Before we get started with today's podcast episode, I just want to take a minute to tell you about a free masterclass for dance teachers that I have coming up soon. The NeuroFlex Masterclass, Identifying the Missing Link in Your Dancer's Flexibility, is happening Monday, August 19th at 10 a.m. Pacific. The nervous system is queen when it comes to the body. It controls our ability to see, think, feel, breathe, and move. This means that it also controls our flexibility and our mobility. Nervous system dysregulation is one of the biggest factors limiting dancers' mobility that most dance teachers miss. In this masterclass, you'll learn about the link between the nervous system and mobility and how to harness the power of the nervous system to improve your dancer's flexibility. I would love to have you join me on Monday, August 19th. So for more information and to save your free spot in the masterclass now, you can go to www.allegroperformance.com/masterclass. And now, here's today's episode.
Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. Today, we are going to be talking all about nerve glides or nerve gliding, or sometimes you'll hear it referred to as nerve flossing or nerve mobilization or dural mobilization, or honestly, the list goes on and on. So there's a whole bunch of different ways that people sort of refer to this, but they're all talking about the same thing. So anything that kind of incorporates the word nerve or neural, and then gliding or sliding or flossing or anything like that, it is all the same thing. The reason I want to talk about this today is I've gotten a few questions about it recently. So via social media, just people dropping questions in my DMs, and I got an email about it as well. People kind of asking, what is nerve gliding? How does this sort of fit into dance? Like that type of thing. So my general rule of thumb is anytime I get more than a few people asking the same or similar questions, seems like a good idea to do a podcast episode about it. So that's what we are going to dive into today. I have covered this a tiny bit in a previous episode. It was episode 13, and it was part of the flexibility series that I did back, I believe it was in January. So there's a 4-part series on flexibility, and the third episode in that series was all about how the nervous system affects mobility. And as part of that episode, I did touch a little bit on nerve mobilization, I believe. So if you have not yet listened to that episode, I would encourage you to go back. It's episode 13. I will link it in the show notes here as well, because it'll give you a little more context at specifically looking at how nerves and the nervous system affect mobility and flexibility. Today, I'm just going to talk a little bit more generally about nerve gliding and where and when we might use it, not just when we're working on flexibility, but in other sort of situations and for other purposes as well. So if you haven't listened to episode 13 yet, I encourage you to go back and do that. But today, like I said, we're just going to dive in and talk a little bit about nerve gliding. I think the reason that this has come up as a question recently from a few different people is that there's starting to be maybe a little bit more awareness of this in sort of the general population. And I have no idea if this comes from like a social media thing, if there's more accounts posting about it or incorporating it into sort of their treatments, or I'm not really sure exactly what the uptick is. It is something that has been around in the physio or rehabilitation world, not for a super, super long time, but certainly the whole time I have been practicing. So when I was in school more than 15 years ago, let's say close to 20 years ago, this stuff was being taught, but I would say it was still relatively new at the time. So I know physios who trained, I actually was just chatting with one, she's retired now, but she trained, I'm going to take a wild guess and say that it was maybe 40 or maybe even longer ago than that. And we were kind of talking about this stuff, and she was saying, that like wasn't around when I was in school. Like that wasn't part of their training and was newer information. So this has been around in the rehab world for, let's say, 25-ish years. But like I said, I think it's just starting to maybe make its way into a little bit more general population or more athletic populations, more kind of sporting populations, and how it might be applied or utilized within those populations and not just in a rehabilitation setting. So I don't know for sure, but I speculate that that might be why people are starting to ask more questions about what it is. So before we can dive into exactly like what nerve gliding is, we really have to understand a little bit about the structure of the nervous system and the nerves in particular, and how they're formed in the body in order to understand why this principle of nerve gliding or nerve flossing actually works. So nerves are an inelastic substance within our body. And the cool thing about the nervous system, and the thing that makes it the most unique, is that it is continuous from the very top of our head all the way down to like the tips of our toes. So that's really different than our musculoskeletal system that is made up of bones or muscles or tendons and what have you, where they're very local and work kind of segmentally or locally within a region of the body. So if we think about a muscle will cross one or sometimes two joints within the body. So if I'm going to use the hamstring muscle as an example, because I'm going to use this as an example later on in the episode. So if we think about our hamstring muscle, it crosses two joints. It crosses our hip joint and it crosses our knee joint. So the hamstring can work as a hip extensor or it can work as a knee flexor. And so it's just local and only influences that area of the body. Now, of course, there's fascial attachments that make everything in the body relate to everywhere else in the body kind of in various ways. But if we think structurally, they are local and only really act on one segment of the body. Nerves, on the other hand, like I said, are continuous from the top of our head down to the tips of our toes. So all the nerves in our body stem off of our central nervous system. And our central nervous system incorporates our brain and our spinal cord. So all the rest of the nerves in our body either come off of our brain, and we call those our cranial nerves. So they come out of our head, and most of those nerves stay up in the top part of our body. So they're nerves that will control eye movements, facial expressions, things like that. And then we have the nerves that come off of our spinal cord, and those are nerves that go out to the rest of our body, to our arms, to our fingers, to our legs, and we call those peripheral nerves. Now, it seems like those nerves should be local in the sense that, like, if we think of, we'll use the example of the sciatic nerve because I think a lot of people have heard of that and are a little bit familiar. The sciatic nerve comes off at the low back, so it comes off of the spinal cord, but in like the low back region, and then it comes down our leg and it goes all the way into our foot. It splits along the way into branches, but for the most part, we'll just say that the sciatic nerve comes down the back of the leg and in like all the way down the leg and into the foot. It's easy to think of that as just like a segmental nerve that only affects that one leg it goes into. But like I said, it's actually continuous with the entire nervous system. So because of the way that it attaches into the spinal cord and the spinal cord attaches into the brain and all those other nerves come off of it, anything that influences one nerve in our body actually by default influences every other area of our body or along the length of that nervous system. So it is a continuous structure throughout our body, and that's really important to remember when we start to talk about like what actually is nerve gliding. The other thing we need to know about the nervous system that's different than, again, like the muscular system is, like I said earlier, nerves are generally inelastic. So they don't have that stretchy elastic property that muscles might have. So the easiest way to think about this in terms of an analogy is muscles are like a rubber band or an elastic band. So we can stretch them and make them sort of longer in length, but as soon as we let go or if we stop that stretch position, the muscle's going to kind of like recoil back to its original resting length. So we have elastic properties within muscles. Nerves, on the other hand, do not stretch. They're made up of a different type of tissue that a muscle is. So again, it's not an elastic tissue. So when we pull on a muscle, it doesn't have pull on a nerve, it does not have the ability to stretch. So the easiest way to think about a nerve is that it's more like a piece of string or a rope. So if you imagine that you have a piece of string and you're holding each end of it, you can sort of let that string go loose between your fingers so you don't have a lot of tension between your two fingers. And then if you pull your fingers apart from each other, you can take up the slack or create tension on that string, but it doesn't materially change in length. It does not stretch beyond that point. And that is the same property that nerves have. So when we're thinking about muscles versus nerves, think about muscles being like an elastic band and think about nerves being like a piece of rope or a piece of string. And this becomes important when we talk about kind of nerve gliding or nerve sliding. So when we talk about sort of like the nerves within the nervous system or within the body as a whole, we'll often use the term neurodynamics. And sometimes people have heard of that term but aren't 100% sure what that actually means. And neurodynamics is just the word that's used to describe the interplay either between different parts of the nervous system, so maybe between those peripheral nerves and then the central nervous system, or between various peripheral nerves, or it is used to describe the interplay between the nervous system and the musculoskeletal system, because like we know, everything in the body is kind of related to other parts of the body. And so although these nerves are following their own path wherever they go in the body, they're constantly interplaying and interacting with the musculoskeletal system. And this will make sense with some of the examples I'm going to give you in a second. So, like I said, before we can actually get into nerve gliding, we really need to understand kind of those properties or the structure and anatomy of the nerves and how it varies to the musculoskeletal system. Now, nerves adapt to movement within the body by sliding or gliding and changing tension. So, like we just talked about, they don't actually stretch. And so if you think like, okay, well, if I take my leg into, an elevated position, like say an extended position, or do like a kick or a grand battement or something like that, and you're thinking, oh, well, if the nerve doesn't stretch, how does it allow that to happen? It allows that to happen by this sort of gliding or sliding that happens within the system. So the nerve is not going to change in length, but if you think back to that example of that like piece of string, generally at rest, the nerves within our nervous system are going to have a little bit of like quote unquote slack to them. So they're not on maximal tension at all times, or they should not be on maximal tension at all times. So when we go to move and say kick our leg up, we're actually just going to be creating or sort of taking up the slack and creating maybe more tension within that nerve, but we're not physically stretching that nerve. So if you imagine that that nerve is attached to the tip of your toes, and then obviously it comes all the way up the back of your leg and attaches into your low back, when you're standing just with your feet on the ground, that nerve is going to be relatively in a relaxed position or have some slack on it. And then as you bring your foot up to extend your leg, so let's say we're going into a développé or a grand battement or some sort of an extension position, you're pulling from the foot end of the nerve and kind of just creating a little bit more tension on that end, which is going to allow the nerve to slide towards that end of the body a little bit more so until the leg comes back down, and then the nerve is kind of going to slide back to wherever its starting position is. So this movement or interplay happens with these sliding or gliding movements. So the nerves are constantly like in motion, or they should be, but we're just not stretching them necessarily the same as we're stretching a muscle. And this is a really important concept to be able to understand, because this is where the principle of nerve gliding exercises comes in. Because sometimes if we have dysfunction within the nervous system, and this can happen for a variety of reasons that I'll talk about in a second, we lose the ability of that nerve to kind of like adapt to movement that way, to slide or glide, to adapt to the movement, and that can create dysfunction within the system. And a lot of times that dysfunction that's created will mimic or present as potentially like a musculoskeletal injury. So one of the most common things that I will see is people coming in and sort of saying, oh yeah, I've been having this hamstring issue. I've strained my hamstring somehow, and now my hamstring keeps getting really irritated with certain movements. But when we actually assess them and look at it, it's not a hamstring strain that person's dealing with. It's actually irritation within the nerve there. And in that case, it's sort of the sciatic nerve for the most part, because the sciatic nerve follows a similar path down the back of the leg that the hamstring does. So it's really common that we'll see that people think they're dealing with one particular type of injury, but actually it may be the nervous system kind of masquerading, and it could be a nerve mobility issue where those nerves have lost the ability to slide or glide properly. And so oftentimes people are like, yeah, I've really been working on like stretching my hamstring out and trying to do all these things to make their hamstring better. And really it's actually like made things worse. And that might be because they're just kind of like yanking on the sciatic nerve. But if the sciatic nerve isn't gliding for whatever reason, that's actually making things worse rather than improving that pain. And that's often why they end up in the physio clinic, is because they're like, I've been doing all the things I would normally do when my hamstring feels tight or my hamstring feels sore, but it's actually making it worse instead of better. And it's because maybe we aren't addressing the sort of root cause of the problem in through there. So like I said, if these nerves, this nerve gliding or this movement ability that we need within the system gets interrupted for any reason, that can create dysfunction within the system. So some really common reasons why we might see nerves lose some of their ability to glide properly. So sometimes this is related to things like injury and stuff like that. So in this case of my example of sort of a sciatic nerve / hamstring thing going on, in some cases, it actually does start as a hamstring injury. So somebody might strain their hamstring, and in the healing or recovery process of that, they may actually end up with a little bit of like scar tissue or adhesions or something like that in and around the hamstring that then starts to irritate the sciatic nerve and kind of perpetuates these symptoms as continuing on like a hamstring injury. So certainly we can see issues arise when there has been an injury, and we see it a lot commonly if there's been like some pretty traumatic injuries. So people who have had complex fractures or have had surgeries and things like that, we can get a lot of sort of scar tissue buildup and things like that that can really influence the nerve's ability to slide and glide within its kind of containers in through there. So that can be one reason why we will see these kind of, we'll call them like adverse neurodynamics, or these nerves that don't glide kind of properly in through there. Another reason that I see commonly in dancers has to do with growing and sort of especially the adolescent growth spurt. There is actually a podcast episode all about the adolescent growth spurt, and I think I do touch really briefly on nerve mobility within the adolescent growth spurt episode as well. I can't off the top of my head remember what episode number it is, but I will link it in the show notes. So if you are interested in learning more about the adolescent growth spurt, go and check out that episode, because I do touch briefly on the nerves. But certainly when kids are growing, we will sometimes see that the nerves lose a little bit of their ability to slide and glide in through there. So that can be a reason. Anything that causes compression through the nerves can influence their ability to slide and glide. And so we will often see this with muscles that are getting like really tight or maybe compressing on certain nerves. So in dancers, again, the sciatic nerve is a really common one, but it might not be the hamstring that's always irritating it. A really common area where we see it might be being compressed is often in the back of the hip. So because dancers spend so much time standing in turned out positions, our external rotators or deep hip rotators will often become a little bit overactive, or they'll get a little bit tight and restricted. Piriformis is one that's often like implicated in this, although in my clinical experience, I actually think that a lot of times it's the even deeper rotators. So the ones that are slightly more inferior are sometimes the ones causing more issues than piriformis itself. Piriformis can absolutely be causing issues as well. But if any of those muscles get overly tight because of how they cross the path of the sciatic nerve, they can certainly influence the kind of ability of the sciatic nerve to glide or slide within sort of the system in through there. And so I'm going to continue to use the example of the sciatic nerve just because it's easy and most people can kind of visualize that. But this same thing can happen in anywhere in the body and any nerve path. And so we see it in upper extremities as well, where we can get nerves in the arms or in the upper extremities that sort of lose their ability to glide really effectively. And muscle tension or something compressing on that nerve can absolutely be a cause of that. So there's lots of other causes of things that can cause these kind of adverse neurodynamics, but those are a few of the common ones that I will see within dancers. So in these cases, when we are thinking about, okay, how do we want to deal with this? How do we address this issue? We want to make sure that we're addressing any of the kind of root causes. So if it is an issue where there's a muscle that's tight and it's compressing on the nerve, before we do any sort of neurogliding exercises, we want to make sure that we're addressing that root cause, because otherwise we can do all the nerve glides in the world, but it's going to continue to be an issue if we're not removing the root cause. So that's obviously the first thing, is figuring out, okay, where is this coming from? But once we have done that and addressed that, we can implement these little exercises that we often refer to as nerve glide exercises. And this is where the questions have been coming in, as people being like, what are nerve glide exercises and should I be doing them, basically? And so nerve glide exercises utilize that principle of the nerves being continuous throughout the entire body and then their ability to adapt to movement by sliding and gliding. It utilizes those principles to kind of get the nerves to move throughout the system in the body. So when we actually look at these exercises, and if you see somebody doing them, they don't look massively different than dynamic stretching might look, but oftentimes the components that we're adding into it in terms of what part of the body we're moving is very strategically implemented as a way of biasing certain nerves in the body. So I'm going to stick with that example of the sciatic nerve, or that sort of like hamstringy type injury in the back of the leg, because like I said, it's an easy one for people to visualize. In the case of the hamstring, because it crosses the hip and then it crosses the knee, if you're lying on your back and you bring your leg up towards, 90 degrees, so that classic straight leg raise or hamstring stretch position, if you come into that position and your foot's nice and relaxed and you get to the point where you're feeling tension down the back of your legs, we would, perhaps rightfully so, assume that we're getting kind of a hamstring stretch in that position. And super commonly in the dance world, well, probably in every athletic world, but certainly in dance, and I know that I was given this cue all the time when I was a dancer, and I actually certainly used this cue when I was a teacher as well, you'll hear teachers then tell dancers to keep their leg in this position and flex their foot to get a deeper hamstring stretch. But if we think about that position for a second with your legs in that kind of, let's say it's at 90 degrees, depending on how flexible you are, and all you do is flex your foot, but you don't move anything else, we have not moved the hip or the knee at all. So we have actually effectively done absolutely nothing to the hamstring muscle in that position. The only thing that we have done by flexing the foot is created more tension on that sciatic nerve by taking the distal, or the furthest away part of the sciatic nerve, further away from the back of the leg. So by flexing the foot up, you're creating more tension in that nerve. So that's a little test that we can use sometimes to see if people maybe are tight in their sciatic nerve, if there's a little bit like more tension in that nerve in through there, but we are not increasing the stretch in the hamstring muscle in that position. So we can use that knowledge to then create a nerve gliding exercise in the sciatic nerve. And that position is one of the most common positions that will actually do a sciatic nerve glide. So really basic, if we just wanted to do a really entry-level sciatic nerve glide, you could, in theory, come into that hamstring stretch position and then just alternate between flexing and pointing the foot. Now, in that position, all you're doing is creating more tension on the nerve and then creating less tension on the nerve. So we actually call these like nerve tensioners more so than nerve glides, because the other principle with nerve gliding exercises is as we create more tension on one end of the nerve, we generally want to take the tension off or give the nerve a bit more slack somewhere else along the path of the nerve. So in this case, if we wanted to do that, and hopefully you can still visualize this in your head, because I realize this is starting to get a bit harder to visualize with just like a verbal description. But as you flex your foot, we're creating more tension. But if we bend our knee a little bit, we'll actually take some of the slack or the tension off of that nerve. So you could flex the foot and bend the knee a tiny bit, and then you're going to straighten the knee and let the foot relax or even point the foot. So you're going to alternate going in and out of these positions. And so one of the principles with nerve gliding is that you're continuously moving in and out of the positions as you're doing it. So we don't hold it as like a static stretch like we might with some muscular stretches. So you're just going to move in and out of those nerve gliding or nerve flossing positions. So that's just one example of how we might go about creating a little bit of a nerve glide exercise. The general principle, like I said, is you're going to create more tension along one end of the nerve or at some point along that nerve path, and then you're going to take tension off of that other end of the nerve path. And then you're just going to alternate back and forth. And with that, you get this gliding movement that happens. And this is often called nerve flossing because it's kind of like flossing your teeth, where you like kind of, pull on one side of the floss a little bit more and then you pull on the other side. So you're going back and forth while you're doing it. It's the same idea with these nerve gliding exercises. So when we're doing these, we need to be a little bit cautious, especially if we're dealing with somebody who's had an injury. Nerves can be a little bit irritable, and they can be fairly easily irritated with some of these nerve gliding exercises. So with these, we want to make really, really certain that we're not pushing into pain as we're doing it. And if anything, we often want to feel almost nothing. So dancers are really used to like wanting to feel stretches, and I really want to feel like I'm gaining something, and it should be borderline painful and kind of pushing into it. And if it doesn't feel intense, they don't feel like they're gaining anything from it. And that's kind of a hard mindset to shift sometimes. But with nerve gliding and nerve mobilizations, it's important that we don't kind of push into those sorts of sensations. If anything, we'll sometimes tell people you barely want to be able to feel it. Or I will sometimes say, okay, I want you to feel this 3 out of 10 while we're doing this. So I don't want you to be feeling it 6 out of 10 or 7 out of 10. So it's really important that we stay within that really gentle range of things while we're doing it, because nerves can be very easily irritated, and they also have what we call a latent effect. So sometimes you don't really feel it a ton while you're doing it, but then maybe an hour or a few hours later, it's really irritated the nerve and you might be getting more pain in that area. So we need to be careful about how we go about introducing the nerve gliding. We always want to start slow with nerve gliding, so less is more. I'll honestly do just a few repetitions to start with, see how people respond to it, and then really slowly, gradually add on repetitions. So this kind of comes back to that original question that people were asking was, what is nerve gliding? And hopefully you have a better idea of what it actually is, or sort of what it entails and how it's a bit different than regular stretching. But also people were asking, should I be doing this? I'm hearing about this or seeing this. Should I be doing nerve glides? And there is absolutely a time and a place for nerve glides. And I think dancers for sure benefit a lot from them. So there are a few different benefits to nerve gliding beyond just potentially decreasing pain. So we're often introducing them because people are having pain in certain movements or in certain positions. And we know that nerve gliding exercises do help to decrease pain. In studies, they'll look at what's called the pressure pain threshold, and they look at that before people have done these nerve gliding exercises and afterwards, and people actually are able to decrease their pain or increase their pain tolerance, as it might be, with the introduction of nerve gliding exercises. But there are other benefits as well. And one of them is that we often do see increased mobility. And I think that this is why dancers are should I be including these? Are they going to be helpful? And the answer is a little bit of it depends. So I would say most dancers probably will benefit from some form of nerve gliding exercises, but because of how sensitive the nervous system can be, and because of some of these things we were talking about in terms of not wanting to irritate the nerves, I do think that this is something that shouldn't just be like thrown at dancers willy-nilly and every dancer be doing the exact same routine. So just because one dancer needs some sciatic nerve glide exercises or some nerve gliding exercises for, let's say, their sciatic nerve, doesn't necessarily mean that every dancer does. And so they are not something I necessarily recommend that every dancer just incorporate into their program from like Googling these exercises, because I do think you want to be doing it with some sort of guidance in terms of knowing like how to incorporate it into a little bit of a program or a little bit of a routine. So I realize that's not like the most satisfying answer for people, because I think dancers very much want okay, let's add like these exercises into my stretching routine or into my dance conditioning routine, and it's going to like help improve all of these things. But I do think with especially like nerve mobility stuff, it often needs to be a tiny bit more individual than that. So like I said, there are absolutely benefits, and I think most dancers can benefit to some degree, but I would just be a little bit cautious about how dancers are implementing that into their routine. If you are a dance teacher and you're interested in like more of this kind of like content and that sort of thing, there are like great resources out there. One of my friends does a lot of work within kind of like applied neurology, Missy Bunch, and you can look her up on Instagram. I'll also tag her Instagram handle in the show notes. She's an awesome resource online in terms of using some of these nerve glide exercises in like really practical ways. So if you're a teacher and you're interested in more of that sort of stuff, I would definitely go give her a look. Anna Hartman is an athletic therapist who is like absolutely brilliant. She's one of my favorite people to learn from for a whole host of reasons, but she also has some good content on sort of incorporating nerves and nerve mobility stuff into her programs. So she's another person that you could go check out online, and always has great content on Instagram and that sort of thing in terms of education for specifically healthcare professionals, but some teachers might get some benefit from her as well. And if you are really interested in like some of the nervous system stuff and nerve mobility stuff, and like more specifically how it pertains to dancers, this is exactly what we cover in the Flexibility Foundations course. So the course covers a lot more things than just nerve gliding, but we do spend a good section of the course on looking a little bit more at nerve gliding and how to assess nerve mobility, and then like knowing when to implement nerve mobility into a flexibility program for your dancers. So if you're a teacher and you're interested in this stuff, I highly recommend the Flexibility Foundations course. There's going to be another round of it starting up in September of this year. So if you're interested in that, I will also link that information in the show notes as well, so you can find out about getting yourself on the wait list or getting yourself registered for the Flexibility Foundations course. So, like I said, it's a little bit of a complicated topic in terms of how we actually go about implementing this into dancers' routines, because I don't think it can be really cookie cutter. I do think it needs to be a little bit individualized, but I also think that a lot of dancers do benefit really significantly from nerve gliding exercises. So hopefully this episode has been helpful to you and you understand a little bit more about kind of the mechanics behind nerve glides and maybe why you're seeing and hearing a little bit more about nerve glides or nerve mobility in and about just like kind of the internet land and social media and things like that. If you have any questions or want any clarification or anything like that, please reach out to me. I know some of these topics are a little bit hard to get across in a mostly auditory platform. Sometimes you need a little bit more of a visual platform. I will endeavor to do a few posts in the coming weeks about some nerve glides just on Instagram. Maybe I'll put up a few reels with just some examples of some nerve glides so that you can kind of get a better sense of what exactly those look like. But in the meantime, if you have any questions, please feel free to reach out to me. You can send me a DM. You can email me. All my information is in the show notes. And once again, thank you so much for listening. I really appreciate your support, and I hope you have a great rest of your day.